My name's Pete Edwards. I'm an orthopedic surgeon at Orthopedic 1, and I've lived in Columbus my whole life except for when I was out training, and I've been in practice here in town now for almost 25 years. I treat all patients that have orthopedic injuries, but my specialty is lower extremity sports medicine. Whether you're a young athlete, a competitive athlete in your college or professional career, or an older athlete, or even a weekend warrior, I treat all athletes that have lower extremity sports problems. I chose to go into orthopedics because I love to interact with people and I love to make people better. As being an athlete myself, having those successes and failures that come with being an athlete, you learn a lot about the mentality of the athlete, what drives them to succeed. And I use that every day, trying to relate to my patients and understand what I need to do to get them back to full activity as quickly as possible. I trained at Ohio State for medical school, and then I went to West Virginia University for my orthopedic residency. Great being down in the mountains. Then I trained on both coasts and in the middle, Baltimore and LA for fellowships, and in Oklahoma City for my final sports fellowship. I'm kind of a high energy guy. Most of my partners that don't know me very well are amazed to find out that I love to fly fish. It's a slow, methodical, kind of a tedious sport, but I love it, and it's probably about as different a sport as you would expect from me when you first meet me. The best advice I can give an athlete is really concentrate on fitness and prevention and health so that hopefully they never get injured. What makes me the most happy is to see athletes performing out on the pitch without getting hurt. So if you really attack your sport in a professional manner with diet, nutrition, sleep habits, fitness conditioning, that all helps stay out of the orthopedist's office because you don't get hurt. So I have 4 kids of my own, and I always default to what would I do if my child had the same injury as the patient that I'm taking care of. And I think that that gives you great perspective. If you understand what the parent is going through hearing that their child has an injury, that default of, this is what I would do if it was my child, makes the parents feel much more comfortable with the treatment discussions and the options that we present to them. A good day at work for me is a day when I can make people better. If I can take care of people that have problems that are easily fixable and we can make them active and happy again about their life, that makes me happy as well.